How you doing, everybody? Dr. Jex Alvarez here, and I wanted to tackle kind of a hard subject today. I got asked by a patient earlier today about their mother who was recently diagnosed with fibromyalgia. And fibromyalgia is probably one of the harder disease processes to A, diagnose correctly, and B, treat. Because what I've normally seen with fibromyalgia is a lot of times these symptoms can be mimicked by symptoms of something else. So, for the instance with my grandmother, she was diagnosed with fibromyalgia after being on a medication that she had a side effect to. She had really terrible side effects to statin medication. And it took about 6-8 months for it to build up in her system to have a threshold where she had a symptom. She started having widespread muscle and joint pain. She was then diagnosed with fibromyalgia. She was put on a lot of different medications and ended up making her very sick because it wasn't really what was giving her an issue. Once we kind of looked through her history, went back through that medication list, we were able to switch up that cholesterol medication from a statin to a different medication. All that fibromyalgia type symptoms dissipated. So first and foremost, the diagnosis of fibromyalgia is very difficult and has to be really looked through really deeply. Secondly, once it is diagnosed, what is it? Fibromyalgia is an inflammatory or autoimmune disorder that affects your nervous system. It causes your nervous system to kind of go haywire or act very erratically and be turned on a lot. So as those nerves are turned on quite a bit throughout the day, you're going to react a lot worse to certain stimuli. So you're going to start to notice a lot of widespread muscle and joint pain. What can be done for that is a lot of different myriad of options. From the traditional, more allopathic MD route, where they're using a lot of different medications to kind of synthetically calm down that nerve pattern firing, to more of a more sustainable or natural route, which would be more of a chiropractic route, where we tackle not only your diet, because we would have to tackle some toxicity issues typically, work on some inflammation, but there's some very particular adjustments that can be done to affect your rest and digest type of your nervous system, or your parasympathetic nervous system, where we start to calm down the nerves naturally through upregulating your kind of more restful part of your nervous system, and we can start to mitigate these symptoms extremely effectively. And it's a much more sustainable, easier treatment plan, not only on your body, but on all your organs as well. So, fibromyalgia, again, it's a difficult one, but I wanted to answer this question, particularly for my patient and her mother, to let her know that there is hope out there and there's a lot of different treatment options. But if this is anything that's affecting you or your family, it always starts with a proper diagnosis. So make sure you get in, you get checked. It's something we can do here for you. And if it is something that we know we can help you with, then we jump on and we start tackling it as aggressive as we can to start getting you feeling better. So I hope this answers some questions. Hope you guys have a great rest of the day. Take care.